everyone. Welcome back to Child Free for Life. I would like to announce that we will have Kasey back today, and she will speak on the sterilization options as well as risks and everything around that topic.
Hey, how's it going?
Good. How are you?
Doing good.
Welcome back.
Thank you.
I'm excited to talk about sterilization. Do you want to take it away? Do you want to start?
Alrighty then. I guess let's get started. So I'm gonna start off with a vasectomy. I see a lot more those who have female anatomy asking about those sterilization options. Those with male anatomy obviously have a much different organ system. And I don't see a lot of questions about it because it does tend to be more common, although those born males still do have issues getting sterilized depending on where they live and what their insurance is. So it's not a FAB specific issue. So for those born male, vasectomy is just a procedure that blocks the sperm from entering the semen. Semen will still form. All that stuff will still work exactly how it's been working. Just no sperm can get there to then fertilize an egg. It's a short, like 10 to 15 minute procedure, usually performed in office. It's not really an outpatient, definitely not an overnight unless there are like serious complications. The doctor applies a local anesthetic to the testicles. You can usually get back to your activities in like a day or two. Traditionally, the doctor can make 2 small cuts in the scrotum. And then the tubes that carry the sperm, which is, I'm probably going to butcher this, vas deferens, they're then blocked up. Sometimes they can remove a tiny piece of the tube. Other times they'll be tied, blocked with surgical clips, cauterized. Those are all options similar to a tubal ligation. The more modern method they use is scalpel-less, no scalpel. They basically take a little needle and just laparoscopically just cut the tube or cauterize it or however that particular doctor wants to do. But yeah, that's vasectomy in a nutshell.
Is it true that it's reversible, that you can go back and have it brought back?
Kinda. So the thing with a vasectomy is it's technically reversible. It's not guaranteed. You should probably not get a vasectomy if there's any chance in the future that you want children. It should be considered permanent. Reversal is possible. It is not guaranteed. And the longer it's been since you got your vasectomy, the less likely it is for a reversal to work. Now, with that said, a vasectomy is also something you kind of have to watch. Depending on the method the surgeon uses, also similar to a tubal ligation, it can heal itself, and then your sperm will then enter your semen and can fertilize an egg. So you do need to get tested. Your doctor will tell you how often. I believe it's usually 2 tests, 1 shortly after your procedure, 1 a couple months after, to ensure that there's no sperm entering. Obviously, if you get them cut and then cauterized, that's probably your best method. That means reversal, and you're not going to have a good chance of reversal. Meanwhile, if you just do clips, yeah, your reverse is probably going to be pretty good.
What is usually the time that it's safe to have unprotected sex after the procedure, that it's for sure there's no risk of getting pregnant?
For sure. They do warn you to use condoms, I believe, or another form of birth control. I believe it's for 2 months. After your second test, a facility will do a sperm count. If you have no sperm, you can't.
Very good.
You can't have children. So once you get that test back, that's when you can have unprotected sex. It is still surgery. It's still a procedure. A lot of people will say, oh, just have your boyfriend get a vasectomy. It's easier. And yes, it is easier, but it is still their body. It is still their choice to get one. And there are still complications that can occur. Like they can end up with lifelong pain, or the surgeon could nick something. There's a lot of different complications, just like with female surgery or, female-bodied surgeries. So it's not a thing to be taken lightly, just like all the other sterilization options. I kind of see it thrown around a lot as a quick and easy option. And yes, it is quicker. Yes, it is typically easier, but there is still risk.
Yes, and I liked what you mentioned during our other call. You as a female, you're still not 100% protected if something happens, if you
Mm-hmm.
get attacked or whatnot. Like you yourself still can get pregnant, like in different
Yeah,
ways, right? So another reason to go for it ourselves.
exactly. I'm not saying guys shouldn't go for it. Like if they're child free and they don't want children and they want to take that into their own hands,
Mm-hmm.
awesome, solid, go for it. Um, if you have female anatomy, it's basically your decision on if you have a male partner, if you want to encourage them to get a vasectomy and support that, or if you want to get an equivalent for yourself, and have your partner support you and do that for your body.
Mm-hmm.
It's kind of the best way to go about it.
Yes.
Yes. So next up on the list is a tubal ligation. That's what most people commonly think of when they think of female sterilization. A lot of the times they think, oh, the doctor pops in, puts in clips, and it's not super effective, right? It can be. It can also not be. It depends on the
Mm.
method. So tubal ligation is usually known as tying your tubes. That's what everyone calls it. It prevents the egg from traveling and meeting the sperm because your tube is blocked or cut or any other variation, similar to a vasectomy. Um, it's minimally invasive. It's very similar to a bilateral salpingectomy, actually, where it's usually camera through your belly button and little surgical arms out at each hip, or maybe two on one hip. Both are used. Um, so exact same as the bilateral salpingectomy, basically. You do go under general anesthesia. It's generally an outpatient procedure. You go into the hospital, get put to sleep. They do the surgery. You wake up, go home. If there are any
Mm-hmm.
complications, you could potentially stay overnight. That's something that a surgeon would go over with you. Um, so for the actual sterilization itself, there's multiple ways to do it. They can cut the tube. They can put in clips, which usually isn't done. And I believe some things like Assure, they're just not used anymore because the failure
Mm-hmm.
rate was so high. They can cauterize. The recovery's about 2 to 4 weeks. 2 weeks, you'll have weight restrictions and other restrictions like don't go into the ocean, don't go into a hot tub, things where, stuff can get into your decisions and kind of make a mess.
Yeah.
And then 4 weeks is typically when people start feeling good and totally 100% back to normal. Um, it is over 99% effective. It has the same effectiveness as an IUD. Now, a lot of people will say, well, why won't I just get the IUD? My answer to that is so the copper IUD can cause increased flow and heavier, more painful periods. Hormonal IUD is obviously hormonal. If you like the hormonal options, you can stay with your IUD if you don't want a surgery. That's totally fine. If it removes a period or levels out your skin or your moods, cool, stay on it. It's the exact same effectiveness. The IUD obviously has its own risks. You should be aware of them and talk to your doctor and then determine which you prefer. But the effectiveness for a tubal also kind of varies on the method. If they cut out a portion and then cauterize the ends, that's pretty darn good. I would get that. I'd be totally fine with that. If they just shove in a clip, that's not super
Mm-hmm.
great. And it's also kind of similar to a vasectomy where it's preventing things from traveling. And like a vasectomy, a tubal ligation can technically be reversed. Again, depending on the method. If it's tied, a reversal, better chances. Cut and cauterized, not so great. Another thing to note, I see a lot of people asking, oh, if I do this, will my period stop? Will it impact my hormones? Will my period get heavier? Answer to all those is no. It doesn't. Your ovaries control your hormones, like in that
Mm-hmm.
sense, essentially. All the period stuff, that's in your uterus, that's not being touched. The fallopian tubes are just damaged that way they cannot let an egg travel, basically. You might have some side effects 3 to 6 months if you're coming off of hormonal birth control. It's from the hormonal birth control. You might have some other side effects. That's from anesthesia. If they don't go away after I'm not a medical professional. This is just
Mm-hmm.
from what I've been seeing and hearing and talking about. I would say after 6 months to a year, you should probably be a little concerned. But like the first 3 months, if things are wacky and weird, you had a major surgery. It is a major surgery. Don't be terribly concerned about it quite yet.
And then I guess everybody is different, so everybody's gonna recover differently, right?
So the bilateral salpingectomy would be next. That's what I personally had. I got it done in 2022. That's kind of now considered the gold standard for female-bodied sterilization. It completely removes the fallopian tubes. Tubal ligation, just a little bit is cut. Bisalp, the entire thing is cut. Minimally invasive, laparoscopic, exact same as the tubal, camera in your belly button, little surgical arms on both or one side of your hips. Usually return home the same day. Go to the hospital, go under, get the procedure, go home. If there's a complication, you might stay overnight. That's something to talk to your doctor about. Officially, it is also the same as an IUD. Officially. Realistically, if you get a bilateral salpingectomy, you cannot get pregnant. There is no tube. There is no way for the egg to travel. There have only, to my knowledge, been 4 recorded cases, 6 supposed cases that weren't confirmed as far as I'm aware. It's basically 100% unless you happen to be unlucky and you fell pregnant like the day of your surgery and they didn't catch it. Like that's pretty much the only way you could get pregnant. Or if the surgeon totally botched the surgery and left your fallopian tubes in, which would be wild. Those are really the only ways you could get pregnant after one. There's also a reduced risk of ovarian cancer, and that's because since your tubes are gone, the cancer can't form on your tubes. That's how that works. Otherwise, exact same as a tubal ligation.
So if somebody is deciding between the two, would you just recommend the complete removal just because of the extra benefits it has?
Yeah, I would say so. The bilateral salpingectomy is the gold standard, and it's the gold standard for a reason. It's basically the same procedure, but it's essentially 100% effective. And also it has the added benefit of ovarian cancer cells cannot form cancer since there are no tubes. They can form cancer, obviously, on your ovaries and whatever, but not on the tubes. So it does reduce it. Some insurances will not cover that. If you're in the U.S. and you have ACA compliant insurance, they're required to cover one form of sterilization for females. That can be a hysterectomy, a tubal, or a bisalp. They can choose any one of those 3 or more, but at minimum 1. Your doctor also kind of determines it. Some won't do a tubal, some won't do a bisalp, some won't do a hysterectomy. So it depends kind of on a myriad of factors. My personal opinion, again, I'm not a medical professional, this is just my own opinion. If I had only been offered a tubal, I would have taken the tubal. I took the bisalp because that's what was offered to me. Unless you have a higher risk of cancer, I personally don't see a huge difference between the two as long as the tubal is the one where they cut and cauterize. To me, that feels perfectly safe. I would take that in a heartbeat. It depends on you and your own risk level tolerance. And if you want to keep looking for a doctor who does offer a bilateral salpingectomy.
So theoretically, we would need to ask what method they use for the tying or cutting. Or
yeah, what method in general would be best? Because a lot of people, insurance agents, some nurses, some doctors will use the terms interchangeably. They'll call it a tubal, it's a bisalp. They call it a bisalp, it's actually a tubal. There was one person in our group who scheduled for a bisalp, ended up getting a tubal, was quite upset, and had to find another doctor to give them the bisalp that they wanted in the first place. So be very clear with your surgeon. When you go into the operating room, you'll be asked, hey, what are we in for? You tell them I'm in for XYZ and confirm with them, yes, that's what I'm in for. Confirm your insurance. Basically do what you can to confirm that you're getting the procedure that you want.
That would be frustrating to get something different than what you wanted. Do you know anything about the risk of the ectopic pregnancies? Is it is it a high risk with this procedure?
I used to know the exact percentage.
Mm-hmm.
I've since lost that information in my brain. If you have, I don't know what it is for tubal ligation. A bilateral
Mm-hmm.
salpingectomy, I do believe it's lowered, but with either method, it's still a possibility. As long as you have ovaries, you're still forming eggs,
Yeah.
and the human body is really weird, and can always potentially find a way to shoot that egg out just into your pelvic cavity.
Yeah.
And then again, human bodies are weird. If the sperm somehow finds its way out, it could meet the egg, and yes, you could end up with a fertilized embryo just floating around somewhere in your body that needs to be removed. That
Mm-hmm.
will always be a risk. Even with a hysterectomy, it's a risk. The only way
Really?
to avoid that is to not have ovaries, basically. But that comes with, you need to go on hormone replacements and yada, yada, yada.
Mm-hmm.
If you are a trans individual, that could actually work for you, because if you want to transition and you're on hormone replacements already, I mean, obviously talk to your doctor, but it doesn't matter as much as if
Mm-hmm.
you're female bodied and identify as female, then it matters a little bit more.
Hysterectomy then. Mm-hmm.
Yeah. So this is the one I see a lot of people using multiple terms and meaning different things, kind of like
Mm-hmm.
how people call tubal bisalp and a bisalp tubal. Same thing with hysterectomy. There's multiple types that you can do. In general, though, it's a procedure where you remove the uterus. So there's a total hysterectomy with a bilateral oophorectomy. I might have butchered that pronunciation. I'm sorry. That's the removal of your uterus, cervix, fallopian tubes, and ovaries. The ovaries are what can control your hormones in that sense. If you remove them, you need to go on hormone replacements, or you will enter surgical menopause. No ifs, ands, or buts. So the important thing with that is with bilateral salpingectomy. That means your ovaries are removed. A normal total hysterectomy without all those added on words, that's just the removal of your uterus and your cervix. Your hormones won't be impacted. Your ovaries are still there. There has been, I think there was a preliminary study showing that you may enter menopause like 3 to 5 years earlier than normal, but it's hard to confirm because that date for every individual is different. So you can't really know
Either
for
way.
sure what
Yeah.
the hysterectomy is. It just your body? Who knows?
Mm-hmm.
It is something to note, though. And then the partial hysterectomy is just the removal of your uterus. It will leave your cervix. So really, there's like the 3 options. 2 if you want to keep your ovaries. I just see a lot of people saying total hysterectomy and thinking it means it includes the ovaries, but
Mm-hmm.
no, removal of the ovaries is a separate procedure. Same thing, removal of your fallopian tubes. That's the bilateral salpingectomy that is usually added onto your hysterectomy, unless you've already had one. Like I've already had that surgery. I'm going to go in for my hysterectomy. So it's just a hysterectomy because they're not also removing fallopian tubes.
What are your reasons to go for that surgery? And what would be generally the reason for people to decide to go for the
So for me, I'm going to do either a partial, which is also sometimes called a subtotal,
Mm-hmm.
or the total hysterectomy. Um, and I think for a lot of people who identify as female, I'm just kind of sick and tired of periods, really.
Yeah.
Like, I'm like, I can't have, or I don't want kids, can't have them. Why do I need a period?
Mm-hmm.
It's basically my thought process on it. So that's why I'm getting one, because irregular, painful, like, yada. Everyone has their reasons. Now a lot of people will ask, why not an ablation? And an ablation, it's not on my list because it is not sterilization. You have to pair it with a tubal or a bisalp or hormonal birth control, non-hormonal birth control. It is not sterilization. You can get pregnant, and if you do and keep it, it is extremely dangerous. So be very cautious getting one if you are not already sterilized. What that does is it severely scars the lining of your uterus inside. So the endometrial lining cannot form. Or sometimes it does form, but it makes your periods a lot lighter. Now, the issue there is if you're under a certain age, like I am, I'm 26. If you're under a certain age, that lining will try to grow back. If it does, it can form pockets. They become painful, and then you need a hysterectomy anyways. It can also make it so if you're having any abnormalities, they can't really test. They can't stick something up in there, take a sample and see what's wrong. It makes things a lot more complicated. It is absolutely an option, and sometimes it's a great option for certain people. If you're on the younger side like me, it's not really a great option just because there's a non-zero chance you will end up in pain while waiting for a hysterectomy anyways. And for the other half of your question, where you're asking about the ovary removal, it's usually if you have hormonal issues like PCOS. Sometimes ovary removal is recommended, or if you have severe endometriosis, sometimes ovary removal is recommended. Or if you're trans, female to male, you might want to remove them because you're transitioning to male and you're on hormone replacement therapy anyways. So you might want to remove that and feel, I guess, more comfortable in your body because you don't have those female organs in you.
So if somebody has endometriosis, the other options won't really make much difference for them in the sense that ovaries are still there and it's
Ovaries are still
mostly,
there, still
yeah.
forming hormones, still telling the body, hey, you should make a lining so that way we can have a child. So that doesn't change unless you remove the ovaries. Some surgeons will remove both, some surgeons will remove one, things like that. And PCOS, that's something you really should talk to your doctor or a surgeon about because they'll know your case a lot better than people on the internet will. Obviously, you can talk to people on the internet. Other people have been through it. They can give you some good insight, some good advice. But no one will know your situation like you and your doctor do.
Another question that comes to mind is, do any of these methods impact your sex drive?
That's person dependent. The hysterectomy where your ovaries are removed, yes, because again, that impacts your hormones, and that will impact your sex drive in various ways. The other ones that don't impact your hormones, it depends. A lot of people do feel like they have a higher sex drive because they're not subconsciously worried about getting pregnant anymore.
It's psychological.
Yeah, it's all psychological. Or if you're coming off of hormonal birth control, as you get back just to like your baseline, your sex drive will go up or down depending on what your baseline is, because hormonal birth control does impact those hormones that control your sex drive. So for the hysterectomy, I totally skipped over the procedure and the effectiveness and the recovery time.
Yeah, go for it.
Yes. So there's a couple different ways to perform a hysterectomy. The usual one is they go in through the vagina and basically pull it out. More or less, that's the least invasive option. That takes your cervix with it, and they just stitch you up, send you on your way, basically. All of these are outpatient. Go in, go to sleep, get the procedure, go home. If there's a complication, or maybe you got some endo removed or something like that, you could stay overnight. It's more likely with a hysterectomy that you'll stay overnight, depending on you and your body and your surgical team. Typically, though, you go there, go home. It is good to note that you cannot do a partial hysterectomy if you do the vaginal method.
Just wanted to ask.
It takes your cervix with you. Now, the cervix, up to you and your doctor, really. Personal preference kind of thing. Some people.
Yeah, but when they pull it out, will they pull out the ovaries as well?
No, ovaries stay.
Okay, cool.
Yeah, because typically you will also have your tubes. Like, I don't know how common it is to go back for a hysterectomy. So if you still have your tubes, more than likely they'll also perform a bilateral salpingectomy at the same time. So they'll still go in. They just won't take the uterus and cervix out that way. And it's a little bit, and it just stays the least invasive option. So leaving your cervix, kind of up to you. Some people like to keep their cervix. Some people don't want their cervix. If you do keep your cervix, you do still need pap smears. And there's a possibility of getting mini periods, because if there's any of that, I guess, womb tissue left on your cervix, that will still form a lining and still make a period. It'll just be significantly smaller because it's only like this much instead of like, your whole entire uterus. And I don't think you can legally claim 100% effectiveness, but if you don't have a uterus, you can't have children, it's 100% effective. There's no way to get pregnant, except for like, body craziness where the egg and the sperm find each other somewhere in your abdominal or pelvic cavity and just go off and have fun. Requires all the fun doctor stuff that goes with that. And hysterectomy is the only method that will completely stop your period. Again, besides the possible mini periods, if you keep your cervix, if there's no womb, there's no lining. You can't have a period. The recovery is person dependent, like with all surgeries. Usually 4 weeks is kind of like when you're feeling pretty good. It is a little bit more intense than the other methods. So you're down for a little bit longer. But generally 4 weeks, you're, kind of back at it. There's a couple frequently asked questions that I see a lot online. So I'm just going to kind of run through them real quick. And if you have any questions, feel free to add on. Like a lot of people will ask, is sterilization free? Yes and no. It depends on your location, your doctor, your insurance. I can only speak for the US because I live in the US. I don't know how it works in the UK, in Australia, in Sweden. I just don't know. You can ask online. There are worldwide child-free doctor lists, like child-free and sterile/seeking sterilization, or r/child-free on Reddit. They're the exact same list. They are worldwide. I would look there just kind of to start, but I don't know what your cost will be. In the US, ACA, like I said earlier, ACA compliant insurance must cover at least one type of female sterilization. You don't choose that type. So if you have ACA compliant insurance, to confirm with your insurance, some reps have no idea what the hell you're talking about. So I would go online and get a form there's many forms that you can fill out and send out to your insurance and be like, hey, I need someone who knows what they're doing to look into this. That'd probably be your bet. Another question is, how soon can I work or exercise or go into the water? The answer to that is talk to your doctor. Average for tubal bisalp, 2 weeks. Hysterectomy, probably more like 4. Talk to your doctor. They know you and your body. You know you and your body. That's the best way to get a concise answer. As a lot of people ask, what do I need to bring with me? Vasectomy. Your doctor will probably give you some painkillers, bring an ice pack. Good to go. For AFABs, you need a driver because after you go under anesthesia, you should not drive. You should not make any serious decisions for 24 hours. Like after my own surgery, I woke up, talked fine, walked fine, sore, but fine. Could answer questions. I went to an Easter party. Don't remember any of it. I have those 48 hours, gone. I can't remember anything. Don't make any decisions after your anesthesia until it wears off. It's very important. Do wear comfortable clothes. I wore a dress. Some people wore baggy pants and an oversized t-shirt, sports bra. Be very comfortable. You will have incisions on your abdomen. Tight jeans will hurt. A lot of people like to bring a pillow to put their seatbelt over. Definitely buy a heating pad. Another thing about female sterilization is the gas pain. And a lot of people think, oh, I'll take a gas X or something. It's not that type of gas. What they do is they basically inflate your body cavity with a gas. So that way they can see inside better with their little robot. They will try to take as much out as they can, but sometimes it gets trapped. So it's trapped. It's in your abdominal cavity. When you go to sit up, it travels all the way up and hits a nerve in your shoulder. Gas X won't do anything because it's not in your intestines. It's just in your body cavity. That nerve really hurts. I personally ended up taking oxycodone for it. Heating pad helped a lot. Walking helped a lot. That's something that's really good to note. Gas X does not help with that. I see a lot of people recommending it. It won't do anything for it. The only thing that does is painkillers, heat, and movement. That will make it,
Mhm.
but will make it dissipate faster. Painkillers and heat will just take the pain away. The only other thing I could say is people ask sometimes about timelines. That's very doctor
Mhm.
specific, insurance specific, location specific. On average, though, the shortest we recorded is 21 days. The average is 2.5 months. The longest is 9 months, 1 day. So that's just in general all procedures. But just kind of to give a baseline.
Out of curiosity, how big are the scars that are left on your body?
They are actually pretty small. They're like maybe that big,
Super
less than
tiny.
an inch. Super, super tiny.
Mm.
I don't use scar cream. If you use scar cream, it'd probably be invisible.
Mm.
I can see a tiny little scar on my belly button and one itty bitty little scar on each hip, but I have to really search for it. I do have some stretch marks on my hips, so it's kind of hidden in my stretch marks. So I have absolutely no idea where
Mm.
they are sometimes.
Cool.
But generally, very hidden, and you can get rid of them easily.
Perfect.
Yeah.
Wow.
So
Thank you so much.
absolutely. So happy to
This
help.
was awesome. Yeah. And if people still have questions, totally leave a comment and we'll get back and answer those
Yeah,
as well.
absolutely.
And yeah, perfect. Thank you so much.
Absolutely. I like to talk about it. I find it to be a very interesting subject that I want more people to know about.